Recurrent pregnancy loss, also known as bad obstetric history or habitual abortions, is one of the most frustrating problems in reproductive medicine today. These are women who've had recurrent miscarriages, and in spite of our doing all the tests, we're not being able to find out what the underlying reason for the miscarriage is, which means it's very hard to counsel these patients, treat them, tell them what their prognosis is. Just to give you some background, actually the chance of having a healthy baby the next time around aren't as bad as you think they are. So that even if you've had 3 miscarriages, you still have a better than 50% chance of having a healthy baby without any specific medical therapy at all, with just what is called tender loving care. So don't get disheartened and don't give up just because you've had 3 miscarriages. You're not the only one. There have been lots of other women, and we still don't know why some of them end up having a healthy baby the 4th time they try or the 5th time they try. There's a lot we don't know about what happens in miscarriages in a reproductive medicine. But part of the problem is doctors aren't very honest and they aren't willing to share their ignorance with patients, which is a tragedy. We all want a doctor to be omniscient, but doctors aren't. But unfortunately, they're not willing to tell you the truth. So doctors will often use these patients as guinea pigs and try lots of empirical therapy. I think that's fine too. There's lots of things we don't know, and at some point we have to tell the patient, look, we've tried everything, nothing's working. Are you willing to try this? It's experimental, it's unproven, but we're happy to try it for you. And if the patient agrees, then I think it makes sense to go ahead. There are lots of empirical therapy options, as you could imagine, for a frustrating problem like recurrent pregnancy loss, which is extremely common, which is something we don't know anything about, which we don't have effective therapy for, and which 50% of patients will have a healthy baby even without doing anything very special, which means, quite honestly, any empirical therapy is going to be successful, not because of the therapy, but sometimes in spite of it. The biggest example, of course, is immune therapy, and people do all kinds of things. Paternal lymphocyte immunization, NK cell testing, intravenous immunoglobulins. Now, I don't believe any of this stuff helps at all. But if patients want to do it, I think that's fine. It's just that the doctor should discuss the ignorance before subjecting the patient to these procedures, because they can be extremely expensive. And it's not fair to use patients as guinea pigs without telling them that we're not sure whether this will help or not, but if you want to try it, we're happy to do it for you. Not sure what to do next because you're not sure if your doctor is sharing information with you? Please reach out to me. I'm Dr. Malpani. I've been running an IVF clinic at Malpani Infertility Clinic for the last 30 years. Our website is www.drmalpani.com, and I'm happy to offer you a free second opinion. See you there. Feel free to email me.